Thank you, Melissa. Uh, and as Melissa said, I am an epidemiologist in the Department of Environmental and Public Health Sciences at UC. And being an epidemiologist, I just want to tell you, I certainly believe in mask wearing during COVID-19, but I'm sitting here all by myself in my home study, so I don't have a mask on. And I want to thank the organizers of this wonderful conference. I myself have enjoyed very much the first two talks, just so much to learn here and to take with you to improve your health. So I'm going to talk today about chemicals and cancer. And there are so many things I could have said, but I decided to focus on the chemicals that are really known to be causes of cancer. And I am certainly available to answer questions after this talk, after the meeting, and the organizers have my contact information. So feel free to contact me with your questions. What I like to say about chemicals and cancer is less is more. Less is more. Less chemical exposure means less risk of cancer. So although we may not know exactly the risk associated with many different kinds of chemicals, if we generally follow the approach of reducing our chemical exposure to all kinds of things, we'll have less risk of cancer and less risk of cancer recurrence. So less chemical exposure equals more health. And so here are some ways this picture illustrates some ways we can be exposed. Oral exposure, a child sucking on the furniture fabric. And let me just say, the exposures to children early in life set their risk throughout their lifetime. So even though those exposures are not close to the time that cancer may occur, they are extremely important. There's also dermal exposure, exposure to your skin when you sit on a couch that has flame retardants that may increase your risk of cancer, and also PFAS, the chemical I study, which is the chemical that has been found in Teflon, and chemicals that are newer chemicals associated with PFAS are now found on furniture. Inhalation could involve an adult or a child breathing material that has flaked or eroded away from the furniture or the carpet and released into the air as particles. So cancer is unlike COVID. It's not caused by an internal pathogen or not caused by an external pathogen. What happens with cancer, everyone has a certain genetic background. We all are born with a certain genetic background. But over a person's lifetime, that internal genetic background interacts with environmental chemicals, such as in diet, smoking, alcohol, other exposures chemical exposures that we incur. And those chemical exposures that cause cancer are known as carcinogens. So these chemicals may cause changes in our internal environment that may lead to mutations, genetic mutations in certain organs, which then lead to cancer. So you can see here a young person, then we have a little bit older person exposed to alcohol or diet, smoking related chemicals, other carcinogens and viruses, and having the beginnings of a cancer. And then later on, especially with a weak immune system, more risk of cancer. And I heard the question earlier about how COVID might increase risk of cancer. One thing is we know that COVID causes a lot of inflammation throughout the body and may weaken the immune system. Although we'll have to wait a number of years to see if the risk of cancer increases in COVID persons who have had COVID, I would not be surprised if it does. So what is really the environment? Here's environment with all kinds of healthy factors, clean air, clean water, everything around us. But when we think of the environment and the risk of cancer, we think of those outside factors that may perturb our internal environment and make us at greater risk for cancer. So, outside factors may include air pollution, smoking, and diet. The earlier talk really set the stage for some of the things I'm going to say about diet. But here are processed foods, certainly a risk of cancer. So I want you to look at these chemicals, this list of chemicals, and it's found in one common food product, a food product that many of you might have had this morning. So do you have any idea of what food product this might be that contains all these chemicals and metals such as lead and cadmium, arsenic, manganese, all kinds of things? Yes, it's coffee. But the tough part is there are demonstrated health effects to drinking coffee also. People who are coffee drinkers, some studies have shown, have less risk of developing diabetes. So how do you know what to do? And it's all a balance of risks and benefits. And that's hard for the person in the general population to appreciate. So that's what I go back to saying, less is more, less chemical exposure, more health. Here are some foods, many of them are processed foods that contain actually flame retardants. There's chemicals that might be in your carpet or on your sofa. And you can see especially these fish contain higher levels of flame retardant. Sausage, which is processed food, and some dairy products. So we know there are no health benefits to ingesting flame retardants, but how much is too much? And we also know there are health benefits to eating fish. So it's a balance. Again, we try to lower the levels of the flame retardants in fish. That certainly is part of the goal. We also need to balance our ingestion of certain foods to lower our intake of chemicals that are associated with cancer. An emerging problem, a chemical exposure, are chemicals found in prescription medications, either or over-the-counter medications or veterinary medications, such as thyroid hormones, estrogens, testosterone. They can be endocrine disruptors. They perturb your hormonal system, which is another way of setting the stage for cancer to occur. They get into the water supply in two ways. One, excretion, people who are taking these chemicals or taking these medications, or animals who are taking these medications, or improper disposal of the medications. Now, at current levels in the water, pharmaceutical contamination is not making water unsafe to drink at all, but it is an emerging problem and something we should be aware of. So how do we get rid of these medications in drinking water? So chlorination, which is a traditional treatment, can remove about 50% of pharmaceuticals because the chlorination changes their molecular structure and helps them to be removed. Advanced treatments, including granular activated carbon filtration, remove medications at even a higher rate. And both the Cincinnati Water Works and the Northern Kentucky Water Department have granular activated carbon filtration. We're very fortunate in this area. So removal is a function of the chemical structure of the drug, and the larger the molecules of the drug, the more that's removed. So right now, we need to drink millions of liters of water a day to reach the levels of prescribed doses of these medications. So you can see, if you're a normal water drinker, you really don't have any risk. But the problem is the increasing levels of these medications in drinking water and in what we call raw water, untreated water. The other thing is when water is treated with chlorine, the microbes in water form what we call chlorine disinfection byproducts. And these are new chemicals that are made by the chlorine, the combination of chlorine and the microbes in the water. And they're actually more polar, make them more mobile in the environment, and some are known or suspected carcinogens. So, bottom line, oops, wrong way. So, what can you do? Don't put unused medication in the toilet. Don't ever do that because that's how it gets into our raw water and then eventually drinking water. Don't throw unused medications in the trash or crush them. Put in cat litter, sawdust, or coffee grounds. They end up in landfills then and in groundwater runoff. So don't dump unused pharmaceuticals. Instead, bring medications to your pharmacy or the police station. They'll take them and safely dispose of them. So I want to turn to lung cancer. Lung cancer causes death in men and women, causes more deaths than any other cancer in both men and women, but it's also the most preventable cause of cancer. As you know, I'm sure, tobacco accounts for 87% of all lung cancer occurrence. Big problem. So, cigarette smoking is certainly the greatest risk factor for developing lung cancer, and the longer you smoke, the greater the risk. But after quitting, the damaged lung will gradually improve, but risk never goes down to zero. And I'll talk a little bit more about this in just a minute. But who else is at risk of lung cancer? Certainly non-smokers who breathe secondhand smoke. Occupational exposures to radon, including radon gas, arsenic, nickel, cadmium, asbestos, and air pollution are all risk factors for lung cancer. But if you have a combination of exposure to both a carcinogen and smoking, then your risk greatly increases. So, in case you didn't know, here are all the chemicals that are in tobacco and tobacco smoke. A large array of chemicals. So it's not just nicotine in tobacco that we need to be concerned about. Nicotine is what causes tobacco addiction. But the carcinogens in tobacco, there are multiple carcinogens in tobacco, a whole soup of carcinogens in tobacco smoke. And we know that how the risk increases is just amazing. So a person who smokes a pack a day, which is 20 cigarettes for a male, the risk of developing lung cancer is 19 times that of a male non-smoker. And the risk of developing lung cancer for a woman is 13 times that of a non-smoker. And if you smoke more than a pack a day, we get to 23 times and 16 times for female and male non-smokers, respectively. But I'm sure you all will say, well, I know this person who smoked their entire life and smoked enough, but never got a lot and never got lung cancer. So one of the big studies that we're involved in at the University of Cincinnati is a study of genetic susceptibility and lung cancer. So we are learning that people who carry certain genetic variants in their blood DNA that they have in every cell of their body, certain genetic differences are at greater risk of lung cancer. And you can see here, this is one genetic variant right here and the risk of lung cancer. And you can see how having that genetic variant greatly increases your risk. So to do these studies, we look for families that have lots of lung cancer. And here are some of our families. You can see the black dots or squares represent people who have lung cancer. And you can see how we find some families that are just loaded with lung cancer. So those are the families that we use to discover these genetic variants like this one. Quitting decreases your risk. So smokers who quit before age 50 cut their risk of dying in half compared to those who continue to smoke. Quitting at age 30 reduces the chance of dying prematurely from smoking by more than 90%. 10 years after quitting, the risk of lung cancer decreases by about 50%. And if you're a lung cancer survivor or cancer survivor, quitting smoking helps improve the body's ability to heal and respond to therapy. It lowers the risk of pneumonia and respiratory failure. And also COVID-19. Smokers become much more sick from COVID-19 than non-smokers. Quitting also decreases the risk of new cancers. Radon is not a chemical, but I just want to touch on radon a minute because it's emerging as smoking rates are decreasing. Radon is emerging as a risk factor for lung cancer. So indoors, radon can become concentrated, especially in newer homes that are more airtight, that have better windows that are more airtight. And radon levels increase, especially in basements. Here's a map of radon levels across the United States, and my circle kind of encompasses Ohio. So in Ohio, we have higher radon levels than in other parts of the country. And in the interest of time, I'm not going to talk about this slide, but you can remediate your home. You can decrease the amount of radon with a vent pipe by adding plastic sheeting and sealing and caulking the lower level of your home. But just remember, if we look at the risk of lung cancer, 90%, 87 to 90% comes from smoking, and only a small amount of risk comes from radon exposure. So with smoking, if we could eliminate smoking as a risk factor, all kinds of cancer rates would decrease. And I just want to show you one other slide. This is Pinney, is something that is in urine of smokers. And these were children, 30 children, all of which had cotinine measurements in their urine. Look at this. Can you pick out the children who lived with a smoker? It's really easy to see those who have had secondhand smoke exposure. Primary prevention, avoid the use of tobacco smoke, chemo prevention, good diet, green tea. Polycyclic aromatic hydrocarbons also are known to increase cancer risk. And they come from grilled foods, from any kind of burning, such as a wood stove, any kind of indoor smoke, burning leaves. So you want to avoid those because they are known carcinogens. There are also chemicals, especially arsenic and cadmium, that are known carcinogens. Arsenic is in pesticides and in wood preservatives, definitely a carcinogen for lung, bladder, skin, kidney cancer. Cadmium, interestingly, the biggest population exposure to cadmium comes from cigarette smoking. There's quite a bit of cadmium in cigarette smoke. Another carcinogen is vinyl chloride. Vinyl chloride, for the general population, the biggest exposure comes from off-gassing of new furniture and new carpet. So think about that. If you get new furniture or carpet in your home or your office, your place of work, you want to ventilate as much as you can and stay away from it as much as you can. So identifying cancer-causing substances in humans and proving that they cause cancer is difficult because there are many, many factors that are related to cancer. And it includes usually laboratory studies first, then animal studies, and then finally human studies. But as I said, it's a complex disease in many causes. One thing we have learned through many studies is that adipose tissue, people who have more adipose tissue, have a greater risk of cancer from a certain carcinogen than those who have less adipose tissue. So human studies are difficult to do. We have a whole variety of carcinogenic exposures, and it's difficult to pick out the one that is the cancer-causing exposure. We also have windows of susceptibility for breast cancer. As Melissa mentioned earlier, breast development, the time of puberty, is a window of susceptibility. So you want to make sure that girls avoid carcinogen exposure during this pubertal development and also in utero when they're developing in the uterus. So research studies try to determine risk. You need large studies. You need repeated studies. So at least 2 studies are needed that show the same relationship between the exposure and cancer in humans to consider the exposure as causal. So just one more slide about safe levels. It's always difficult to determine safe levels. Genetic susceptibility plays a big role. You might want to visit the website of the Environmental Work Group. They have a list of the dirty dozen fruits and vegetables and the clean 15, and also a section of their website called Skin Deep that looks at chemicals and personal care products. But in general, less is more. Thank you very much.